In today's health headlines, nursing homes now have a minimum staffing rule, how your partner's stroke could impact your mental health, and a health advisory by the CDC on contaminated botox. Joining me is Dr. Arjun Venkatesh, Chair of Emergency Medicine for Yale School of Medicine and Yale Medicine. Welcome.
Hi, thanks for having me.
You bet. The Biden administration has imposed the first ever minimum staffing rules for nursing homes, requiring a registered nurse to be on site 24/7. Tell us about this.
This is a big deal. There are over 10,000 nursing homes around the country. And the new rule from the Biden administration would require two things. The first is that there's a registered nurse, which is one of the highest levels of nurse training, be present 24/7 in any nursing home. And the second is that there are staffing ratios, or a minimum number of nurses and nurses assistants available for residents in these nursing homes. This is addressing a huge problem we know about nationally, where nursing home care has struggled to meet the needs of an aging population. It's going to be hard for nursing homes to meet this requirement. There's an analysis out there that said almost 80% of nursing homes in America wouldn't meet the requirement today. And so they have 2 to 3 years to implement this in urban and rural nursing homes around the country. And so we'll have to see how the industry responds and this plays out, but it could mean much better care for our seniors.
Yeah, in the meantime, there's still that shortage. A new study found that spouses of people who have had strokes or heart attacks could be at a heightened risk of depression. What do we know about that?
It's a really interesting study that was done in Japan. They followed, over 250,000 married couples in Japan, where one spouse had a major cardiovascular event, like a heart attack or a stroke. And then they looked at what happened to their spouse. And what they found was that the spouse of someone who suffered a heart attack or stroke or other cardiovascular event had a much higher chance of developing depression. It seems intuitive. We know that the burden on caregivers is large. And I think what this research really shows us is that as a healthcare system and as a country, we need to not only think about taking care of the patient, but thinking about taking care of the caregivers that are around them and helping support them with what are often long and arduous burdens for helping the recovery of their loved ones.
And oftentimes it's all on them, one person. The CDC has issued a health advisory regarding the risks involved with contaminated botox injections. What do we know about that?
Yeah, the important thing about the CDC warning is it's about what they're calling contaminated botox. And what they have found is that there's reports from women across the country, really over 20 states, of some really scary adverse effects that have happened when they had some contaminated botox. Often this might not be botox that was produced in a regulated manufacturing facility, and it may not be administered in a regulated setting like a doctor's office or another healthcare setting. Instead, it's being used at a spa. And so I think the warning for people out there is if you're getting what you think is a Botox injection, you really should ask and make sure that it's an officially manufactured product that was FDA approved and that is being sort of obtained from a major manufacturer of that Botox injection before you use it or take it.
All right, thanks for all that information today. Dr. Arjun Venkatesh, have a good one.
Thank you.